can you tell us a little bit about yourself?
My name is Deon Simpson and I'm a DPhil student in the National Perinatal Epidemiology Unit at the University of Oxford. I'm in my third year of the 3-year program, so I'm close to submitting my thesis.
Why did you want to work on this particular research?
I chose to look at breastfeeding because in my previous job at a government agency, I worked on a project called the Baby Friendly Hospital Initiative, which is a global initiative to promote breastfeeding and to improve the breastfeeding support that women receive in hospital. And through this experience, I became very interested in understanding the factors which encourage women to breastfeed or hinder them from breastfeeding, especially from a population perspective or a public health perspective. And I really wanted to understand how public health policy and strategies could better support women who choose to breastfeed.
How did you find a project and a supervisor?
So when searching for PhD projects, I searched specifically for epidemiology-focused breastfeeding projects that were also fully funded because I'm an international student. And NPEU was one of just a few institutions that had such projects advertised. I also wanted to work here because the research being conducted at NPEU is focused on generating evidence that informs public health policy as well as practice, which is the sort of training that I really wanted out of a PhD.
What would your top tip be for other students wanting to go into research?
So my top tip for other research students or potential research students is to focus on the 3 P's when thinking about your research. So the first P would be project. So think about a project that you'll be passionate about and willing to commit to for 3 years. In terms of second P, so it's people. Try to find supervisors who are inspiring, so they will inspire you throughout your DPhil journey, and they'll encourage you both in terms of your academic pursuits, but also in terms of the career decisions that you'll make after you've completed your DPhil. And the third P is place. So choose a university, choose a department and a unit that will provide the academic support that you need, but will also provide the support in terms of your mental well-being, your emotional well-being, and career support for after the DPhil journey, because all of that is important in terms of encouraging you and motivating you throughout this process. And I think if you have all 3, project, people, and place, lined up, then you should get the most out of your DPhil experience.
Can you tell us a little bit about your research?
My DPhil research seeks to understand the factors which encourage women in the UK to breastfeed. Specifically, I'm analysing population-based survey data that was collected on UK women's breastfeeding practices from 1985 to 2010. And I'm examining the associations between these breastfeeding practices and several factors, including socioeconomic factors, cultural factors, support factors, and policy-related factors. And my main research questions include the extent to which these support, cultural, socioeconomic, and policy factors have changed between 1985 and 2010, given that it's 25 years, which is a very long time, and also the extent to which these changes may have impacted women's breastfeeding practices. So specifically, the extent to which the associations between these factors and women's breastfeeding practices have changed over time.
Thank you very much for taking the time to tell us about your DPhil here at the NPEU.
Thanks, my pleasure.